All right, as people are trickling in, we will start our lecture. We got a lot of material to cover, and so I appreciate all of the in-person attendance. I did believe we have like 20 or 30 people online as well. So welcome. This is lecture number 2 in our wellness lecture series, and our lecture is called Understanding the Foundations of a Fulfilling Life. So when you think of life, it's work and personal and everything in between. I had the honor last lecture of having a brother in arms in Dr. Kulkarni joining me, but then lo and behold, after that lecture, we found out that Chris Wood actually lives in the wellness space as well. And so she contacted us. And so now we have a trifecta of well-being and wellness. And it's been a really fun 1 month collaborating and working on what I think is our personal passions. And it's a lot of fun to go home and if you have some free time to go down the rabbit hole of well-being and create slides and try and communicate it well. So we'll get kicked off. I want to cover, and if those of you who didn't catch the song that was on initially because of getting food, it was John Bon Jovi's song about living your life, and you only have one time to live your life, and wellness is really about making a decision today about those integral things we do that may make us feel sick or depressed or anxious, and then lo and behold 10 years later we'll look back and say I should have made a difference back then. So what are our objectives for the whole series? Education on what well-being is, how it impacts you, implementation of actions to improve your well-being, building self, and meta-awareness. We'll talk about metacognition in a different lecture, but that's the key to gauge progress and pivot points. And so I'm a big movie person, so I'm going to cover this again. This is really you kind of starting to learn what a Jedi is. And it really is, it really does mimic what Star Wars talks about, but it is understanding your power of your mind. And so then sustainability and maintaining your inner peace, I hope the three of us are kind of here. And we feel like we are somewhat graduated from the Jedi Academy, that on days we try and work on our inner peace, on well-being, and then impart it on others. And that's kind of our role right now with the triumvirate that's working on this, and how do we communicate it and you teach the next Jedis in this pathway. Dr. Kulkarni brought up a good point this morning in our meeting. We're not all Jedis yet. There are risks associated with supplementation, heavy lifting, strenuous workouts, all of these things. Just be mindful. I gave the example. For instance, low-dose creatine is all in the news now, how good it's beneficial for your brain and sleep and all this stuff. But for me personally, I have cardiac arrhythmias. Creatine really is not good for that. And so I may think, wonderful, I'm going to make my brain great. Someone told me great. I go use it. It could potentially not be good for me. So just be mindful of it. We are in healthcare. We are lecturing at a hospital, but be mindful of your own personal health and talk to your healthcare provider if you have questions about some of this stuff. And so just reviewing where we started from, our first lecture was an overview. Today we're going to be talking about physiologic well-being, the neuroscience behind it, physiology, sleep, supplements, and nutrition. In May, we're going to go into emotional, intellectual well-being. June will be a social, spiritual well-being. July will be environmental work-life continuum and well-being associated with that. And then in August, by then we will all be integrated in one big well-being family, and we'll figure out what we want to talk about. It may be a rabbit hole deep dive into sleep or brain science or something else. And I think that's going to be a lot of fun. And so today's lecture objectives are physiologic well-being and fitness, sleep knowledge, the brain and planning. It doesn't just come out of nowhere. Meditation and yoga, what does that mean? And who does it, who doesn't? Nutrition and supplementation. So this is a slide we used last time, the different foundations of well-being.
Hi, how are you?
But our goal is linking habits to quality of life.
I couldn't, no.
And preventative self-care, how does fitness and exercise come into it? And questions we ask, are you exercising? Are you eating well? Are you minimizing detrimental food and beverages? Sleeping at least 7 or 8 hours a night. And I'm going to hand off to my brother here, Ryan, for the next slide.
Thank you very much. Frederick. All right, good afternoon. Welcome. Great to see everybody here today. We are going to be talking about physical wellness today. So, what are the pillars of physical wellness? Cardiovascular fitness and strength training. So these are two subjects that I'm going to be talking about today. And then also just touch upon the impact of alcohol and tobacco and THC. And then we're going to also be discussing brain and sleep hygiene, supplements and nutrition, and then personal resilience. Before we start talking about cardiovascular fitness, though, we just want to point out this schematic here, this dimensions of wellness. So if you didn't attend last month's lecture, we talked about the foundations of wellness and how many foundations there were. This goes back to research that was done by Dr. Peggy Swarbrick in the 1970s, and she developed this concept that wellness is actually a pursuit, and your ultimate goal is well-being. That you want to get to that ultimate state of well-being. It's a combination of all of these individual foundations of wellness: social, spiritual, physical, occupational, and that sort of thing. So it's a constant pursuit. It's not just there. You always are going to be, just like you're always going to be a student, you're always going to be pursuing wellness. And today we're going to be talking about physical wellness. The other point that she made is that one foundation will affect many of the other foundations. So today we're going to be talking about partially sleep, the sleep hygiene. So you know how you feel if you don't get one night of good sleep, right? You come to work, you're just kind of dragging. So imagine that happens every day, consistently. Imagine how that's affecting you physically, emotionally, spiritually. Imagine what that's doing at your job. Imagine how good you are at your job when that's happening. That's just one small aspect of physical wellness. So you can kind of see what she means by how one foundation will affect all of the other foundations. So, cardiovascular fitness. So before we proceed, I'm going to ask you some questions. Can I move throughout the day without feeling stiff, sore, or out of breath? Do I have the physical and mental energy to manage my daily routine, both at work and home? Can I easily stand up from a chair, get out of bed, or easily reach for objects that require bending or twisting without going, ugh? 19-year-old happily points out. Can I carry groceries or go up a flight of stairs or participate in physical activities without feeling tired? Do I have a healthy body composition? Or instead, would you want to have improved energy and stamina throughout the day? Would you want fewer sick days? Reduce fatigue? Would you want improved flexibility and mobility with greater ease of movement? Would you want a greater mental clarity and improved mood? And if these questions made you think, then you are starting to think about your physical wellness. So let's start talking about cardiovascular fitness. So many of us are healthcare workers in this room. We all know about the benefits of cardiovascular fitness as it relates to our physical health. Lots and lots of data about it, improved heart health and stamina and energy levels, reduced risk of MIs and stroke and peripheral vascular disease and even death. So lots and lots of data. Going back to the Framingham study of the 1970s, which many of us studied, right to recent meta-analyses that was conducted by JAMA in the late 2000s. But there are other benefits: reduced stress and anxiety, improved mood, cognitive performance, and mental clarity. Articles from the Journal of Psychiatry have demonstrated that exercise and fitness, specifically cardiovascular fitness, improves levels of endorphins and serotonin, increased brain-derived neurotropic factor, which are all associated with improved mood. In fact, some of these trials have even shown that cardiovascular fitness can be a substitute for antidepressants. An additional benefit: immune function. So it's actually demonstrated that you can actually have higher level of white cells, natural killer cells, macrophages, antibodies, improved immune surveillance, reduced inflammatory markers, and overall improved immune function as a result. Right at the cellular level, it's been demonstrated that cardiovascular fitness can do this. But let's also talk in reality. There's been demonstrated that cardiovascular fitness can actually improve your wellness and reduce your sick days. There's a study out of the British Journal of Sports Medicine that showed they took 1,000 people and they split them up into two groups: heavy exercisers people who exercised and people who didn't exercise. And they studied them over a winter time. And they found that the people who exercised took 43% fewer sick days than the ones who didn't exercise. This is another study that was out of the Journal of Occupational Medicine, found very similar findings. On the far left, you have the inactive population, and then a second population that was active, but not really, just like twice a week. And then the third population where they're active more than 2 times a week. And you can kind of see, again, that relationship that cardiovascular fitness helps with their immune function, and therefore they need fewer sick days.
Thank you, Ryan. I'll take it from this point on. So I love that image up on the top right because, many of us do sit in that position. I think it was mentioned by Chris today. But just think about how much we sit and how much our body really dies while we're sitting. Not to be too dramatic, but I love this image. I actually put it on my LinkedIn. Sitting is the new smoking. Right? We don't smoke as much, but at least people got up and went outside and got some fresh air, got some vitamin D while they ingested the smoke. So that's all gone when we think we sit down and just drink our soda at the desk. And so there's a study that came out in JAMA, greater than 7,000 steps a day does lower depression. Depression is a very, very, very big problem in our society. And a holistic way to improve just mental health is take 7,000 steps a day. I count my steps. I either have failed or succeeded at the end of the day. Research suggests walking 9,800 steps, optimal dose for lowering risk of dementia by 50%. I mean, these are pretty easy things to do. You have to be intentional. I know I've got my wellness squad colleagues in the room, and we will get in 2,500 steps just by going around the building for 12 minutes. And so getting 10,000 steps outside can help relieve symptoms of anxiety and depression. And so anxiety, I'm going to keep coming back to mental health because that really is the biggest, I think, obstacle to personal performance, whether it's professional or at home.
So cardiovascular fitness, where do you start? So there may be some people who are well advanced in this journey that are really, really big into exercise, and others that really don't exercise at all. So how do you start? Where do you start? Just start by walking. Just start by walking. 7,000 to 10,000 steps a day is a great start. If you want to look into higher intensity, then definitely discuss with your medical provider. WHO, World Health Organization, and the American College of Sports Medicine guidelines for aerobic activity. Today, target frequency is about 4 to 5 days a week is what's recommended. The target intensity is about 50% of your max heart rate, which you calculate by 220 minus your age. And the target time is about 150 minutes per week. That's been recommended. So about 20, 25 minutes a day of cardiovascular exercise. But bottom line is you want to go low and you want to go slow. Listen to your body. You can incorporate activity into every day. Definitely at work, if you're so inclined. Lots of activities, jogging, walking, swimming, cardio classes, pickleball, you name it. It's all out there. Off work. But at work, there are things that you can do. So I'm just curious, how many people in here have taken the elevator to go up one floor? Yeah. Even if you don't have a card, if you have a card or something heavy, that's fine. But yeah, I mean there's like a classic example. right? You don't have to take the elevator. Here's a perfect opportunity. You go up a flight of stairs. You can join us on our wellness walks. You can, after a meal, instead of sitting around and talking with your colleagues, get up and, walk the hospital or go walk around the hospital. So there's a lot of things that you can do to incorporate activity. Number 2, strength training. So we talked about cardiovascular fitness. Now we're going to talk about strength training. So just like our previous examples, there's lots and lots of benefits for strength training. And we're just going to touch on a few. One big one is metabolic health and glucose regulation. So there's actually a lot of evidence to show that there's increased insulin sensitivity movement of glucose transport proteins to the muscle surface. So what does that mean? That means that when you are exercising, these proteins that are responsible for moving glucose out of the bloodstream into your muscles increase. They all move up to the surface. So as a result, your blood sugar levels drop. When you're exercising, you're producing more and more muscle, and more muscle means that you're going to have a greater glucose reservoir. Which is awesome because as your glucose levels drop, your insulin levels drop. When your insulin levels drop, you go into fat burning, right? So if your glucose levels are high, your insulin levels are high. If your insulin levels are high, you are storing fat. And the other way. So that's why, as long as you're lifting, you're producing more and more muscle, which loves glucose, and it's a great way to get glucose out of your bloodstream. Other benefits include increased resting metabolic rate and lowered inflammatory markers. And one thing is that's kind of intuitive, and I'm sure Dr. Johnny can also agree to, is that definitely lifting is going to help with your bone density. That mechanical loading and that increased muscle will automatically prompt the bone to become stronger. And I think we all know, especially for those populations that are at risk for osteoporosis, this is a wonderful thing, or hip fractures. So lots and lots of benefits. Improved joint and spine stability, improved posture and balance and coordination, muscle resilience, and muscle fatigue. Here's an interesting thing for cancer patients. So obviously, you would think that there are some benefits for cancer patients, like when they're working out, they're going to have better functioning. They're going to have better tolerance to their treatments. They're going to be having more muscle on board, so there's less likely for cachexia, which is that that very thin appearance. But the really interesting part, and this is established in the literature, is that there's evidence to show that strength training can actually reduce the recurrence and mortality of cancer patients. There was a study that just came out of the University of Sydney where they looked at 80,000 patients, and they compared cancer patients that exercise versus cancer patients that didn't exercise, and they didn't really specify which cancers they were, but the cancer patients that exercised had a 30% lower risk for dying compared to the patients who did not. I thought that was pretty remarkable. So basically, just having more muscle on board is protective against cancer. So let's move into healthcare workers. Why is it important for healthcare workers? Well, because there's high physical demands on the musculoskeletal system. So therefore, there are high incidence of musculoskeletal disorders. They're the leading cause of lost work days. Most complaints include low back, shoulder, knee pain, fractures, typically because of the handling and the lifting and the bending and the awkward postures. RNs, nursing aides, and attendants actually take the brunt of that, about 40 to 90%. So kudos to all you that do this. We appreciate that. It's a 5 times higher than industry average, including manufacturing industries. And I was surprised at that, actually. I thought the manufacturing industry would be greater, but healthcare leads the lot. Highest amount of workers' compensation claims, and the annual cost of U.S. hospitals is $2 billion annually. Some individuals with these chronic injuries, they actually leave the profession early. Here's the graph on the left, basically shows again the point about the strength training and injury rates, and the graph on the right The yellow bar at the very top is a population of residential nursing care facilities. And look underneath it. The bar, this is for injuries and illnesses, days away from work. The bar underneath is construction. Which kind of crazy. So where do I start? Talk to your medical provider, to determine your fitness level and get clearance to start training. Consider a licensed trainer or a therapist. Go low, go slow, seek help when needed, and start with body weight or light resistance. Push-ups are great. Dr. Sardarian was mentioning push-ups, sit-ups. Body weight exercises are natural and they're a lot easier. And then if you're interested in progressing, then start looking at progressive resistance. 2 to 3 sessions a week, 8 reps per exercise, 3 reps of 8 to 10, the usual. You want to go slow, controlled movements. You don't want to do any ego lifting because that's a guaranteed path to harm. Been there, done that. My last point is just briefly talk about alcohol, tobacco, and THC. So, as I've mentioned, healthcare, long hours, chronic emotional and physical stress. So it's very easy for an individual who's dealing with a lot of that to lean on alcohol, tobacco, and THC for coping mechanisms. There's really, talking about a safe amount, that's kind of controversial. So the bottom line is you need to be aware, if you do use these products, to be careful of how much you're using and what is the reason for the use. And if you feel like the use is starting to get a little out of control, maybe talk to somebody, talk to your family doctor, talk to a therapist, because every single one of these items is associated with adverse events in potential overuse. Every single one of them, cardiologic or cardiovascular, pulmonary, neurologic, GI issues, and of course, increased risk of cancer. So just be aware of it and get help if you need it.
So for me, everything with urgency. So if you are not getting 7 to 10,000 steps a day, start today. If you are not monitoring with something, start today. Don't wait until summer or, bathing suit time or, wedding. Don't. Just truly start today. If you're averaging 5,000 steps, go to 8,000 steps. And then monitor how you think, how you feel. Right? If you're starting to get mental clarity, you're on the right track, and turn it into a competition with yourself. So I can't encourage that enough. So I'm going to talk about the brain. We're going to do a deep dive on the brain in another lecture, but I really want to set the framework for how you should think of the brain, the most neglected organ in the history of humankind. We absolutely destroy this poor organ and really don't care. So I want us to think of it in a 3-pronged approach. It's called the triune brain model. Came out 80 years ago. People came out, they thought they were smarter, and they're like, oh, this concept doesn't make sense. It actually makes a lot of sense. So think of your neocortex. So I'll show you an image of what that means as the outermost layer, responsible for consciousness, logic, awareness, problem solving. That is your CEO. Everyone in this room has had a dominant neocortex to be able to get into this room. Right? You have made thoughtful decisions, conscious decisions, and have progressed in your life to get to this point. So this is the CEO, the thinking brain. Then you have your limbic brain, the emotional chemical brain. That's the middle layer. Many of you may have heard my lectures about the amygdala and the hijack that happens. This is responsible for emotions, memory, and then chemically creating what the mind is thinking. We may imagine something. I see something that is sad. But if I don't cry or get sad over it, it's not sad to me physically. So the limbic brain turns it into sadness through chemicals. And so it's a protector and also the liability. It's a seat of the autonomic or automatic nervous system. And then you have your cerebellum or the subconscious, to use some Freudian terms. I call that the monkey brain. Unfortunately, in the ICU, that's the part that we check to see if someone has brain function or not, because that is the deepest brainstem region, responsible for basic function, breathing, heart rate, instincts, implicit memories, actions no longer needing conscious thought. It's ingrained. Childhood traumas, things you do for a long period of time and memorize it, that's your subconscious. It gets ingrained. Bad habits, subconscious. So I want you to remember the three brains as we go through it. This will be a recurring theme that's going to come up over and over again. In my house, the monkey brain term is used a lot with my kids. To tell them, are they using the CEO brain or the monkey brain? And so neocortex makes enlightened decisions. Again, you decided to go into healthcare, you did something with your life, you learned, you got educated. This is the part of your brain you used. And so that's the outermost layer. And the frontal lobe is the most dominant portion of that. And within the frontal lobe is the prefrontal cortex, which many people think is the seat of consciousness. And we can talk about consciousness in the 2-hour lecture, which is fascinating. So the more dominant neocortex you have, you tend to make very good decisions in life. Limbic appropriately governs emotions and trusts the neocortex. Appropriately, I put up there. A lot of anxiety, a lot of fears and pathologies we have mentally, depression, anxiety, is because of the limbic brain going off the rails. And you fearing and having anxiety for things that really do not need to be anxiety provoking at that magnitude. And so this is the middle part of your brain. The amygdala is the key driver, but there's other key brain components as well. And then the subconscious remains open to rewiring. The brain is not fixed. By the age of 35, the predominance of who you're going to be is wired. But you can rewire almost anything. Neuroplasticity exists up to any age. You see these folks that are in their 70s and 80s and completely change themselves, they rewired their subconscious. And there's ways to do this. It's remarkable. I hope when I'm 80, people wouldn't even recognize that I was a doctor. I'm doing something so different that I've rewired myself. And so mind and body, this may not completely make sense now, but if you watch this guy enough, this is Dr. Joe Dispenza. He says, getting your behaviors to match your intentions. Didn't hit me first, but then I thought about it over and over again. Again, getting your thinking brain to get your limbic brain to match up, right? You feel what you think. Getting your actions to equal your thoughts, okay? Knowledge is for the mind, experience is for the body, okay? So as you think of the three-part pronged brain model, next time you have a strong anxiety or stress reaction to something, you go to Costco and the line is wrong, just think for a second, which part of my brain is doing this? Does this really matter? I saw a hand at Costco. You're both stressed out. That's why I brought it up. She had a kid with me. I didn't, so she was more stressed than I did. And so this is a really interesting way to view it. If you compartmentalize and intentionally think about how your brain works, suddenly everything kind of makes sense. You make sense, your family makes sense. And so next is sleep, the most important thing our brain does for us, and its benefits. Again, I'm going to constantly come back to mental health. It starts with mental health, it ends with mental health. The reason we're talking about physiologic health is because of mental health. Right? It's not because you want to have a beach body. It's for about mental health. And so sleep is a mood stabilizer, lowers depression, anxiety, stress reduction, memory consolidation. Critical. Sleep doesn't just happen. A lot of us do check emails, and then we just lay down. And we're like, please go to sleep. That's not how it's supposed to work. There's supposed to be rituals, and there's supposed to be a process. And sleep needs to be sacred. I teach my kids. I wasn't taught this way as an Armenian. I don't know, you can talk about your childhood, Sorrow, but sleep was like, we just stay up as late as we can just because, and then next morning, whoever's on 2 hours of sleep, you show off that you can be functioned. But sleep has to be a ritual. You have to make it sacred, and you will see the benefits. And so happy brain, sad brain. Physical health. Again, there's an uptick in autoimmune disorders now, right? How many people in here either know someone have autoimmune? I mean, my family has a lot of this. Why? Start with sleep. And so hormonal metabolic regulation, recovery, longevity, a lot of the blue zone areas you go, where people live into their 80s and 90s, sleep is kind of a process for them. It's built in. They take afternoon naps, but they then go to sleep and they sleep for 8-9 hours. And so physical health is linked to sleep. And if you sleep well, you can do what David Goggins does. So if any of you don't follow David Goggins, he's a pretty impressive human being from a mental health and mental strength standpoint. And so cognitive health, for me, that's what sleep is most important for. I want to know that my CPU is processing at the highest pace it can. You know, I don't know if any of you saw the movie Short Circuit back in the day with Johnny Five, more input, more input. I really do feel like there's a finite period of time that I'm going to learn stuff in this world. I don't want to have brain fog. I don't want to have a sleep if I miss out on 24 hours or 10 hours of cognitive learning. And so sleep is very important. Memory consolidation, learning, all of these things starts with sleep. So I want to have that beautiful side of the brain. I don't want the foggy brain. And that's someone having gone through med school and residency where they basically sleep deprived us for a decade and a half. And so components of sleep, again, you have to understand some of the science to really understand why if you only sleep 6 hours, you wake up groggy, but then you sleep 7, you don't, all that stuff. There's REM and non-REM. Non-REM is REM is rapid eye movement. Phase 1 is the lightest stage, the transition phase. Phase 2 is really the sleep quality assurance team, keeper. I won't go through the details, but what I want you guys to do is as you are sleeping either 4 hours or 8 hours, start to think about how many of these cycles you're getting. So sleep quality and benefit has to do with how many of these cycles you go through. How many REM cycles, how many non-REM cycles you're going through. So if you're sleeping 2 hours and then waking up, sleeping another 2 hours and waking up, you're messing up all of these cycles. So this cycle is almost like a wash cycle. It has to go through its processes to clean the brain out. If you're having chalked up sleep, or you're only sleeping 4 hours and then taking an afternoon nap, none of this is happening. You're messing up your non-REM cycles. Now, REM is where you have increased brain activity. This is when you have vivid dreams. This is where REM is a very important part of your sleep. So if you're not having REM sleep, you're probably not sleeping enough, or your sleep is not good enough. So you should be really working towards this. This is where memory consolidation happens, learning happens, and you got at work or out in the world, it gets inputted as learning. And again, mental health, emotional regulation. I come from a family of very vocal, emotional people, and I can tell if someone has slept or not slept. Sleep really, 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 really regulates emotions. And the cycles. So first REM cycle occurs 90 minutes after falling asleep, and the durations increase after each cycle. So why 7 to 8 hours matters is you're doing the full cycle. Would any of you put a load in the washing machine for 90 minutes and then 30 minutes later just pull it out and be like, clean it up? You wouldn't, right? My wife always adds an additional 15 minutes. But this is the same, but we do this. We always cut it short here and there. We'll just drink more coffee the next day. Coffee does not make up for this. Naps do not make up for this. It does. Now, sleep hygiene is probably my favorite topic. This is a constant fight. The temperature you sleep in matters. It's got to be cold. Sorry for those that like sleeping warm, whether it's not. So ideal, this has been studied, ideal room temperatures are in the 60s. Hate to break it to you. But your body needs to be cold. Brain waves function well, and so we keep our AC on. Or just get a fan. Ventilation. Make sure you have air. These have to be intentional. You can't just go plop on your bed and be like, all right, sleep. Ventilation. Is there a fan blowing? My voice is like this because I opened the window one night. But just make sure stuffy rooms disrupt sleep. Lighting. This is the big one. How many of you fall asleep to the TV, or have your cell phone right next to you, or have an alarm clock with blue light somewhere? Blue light is an enemy. No blue light in the room. Pitch black is where you should be sleeping all the time. If you can't do that in your room, wear shades. It supports melatonin production. Avoid screens and blue tone lighting 2 hours prior to sleep. Yeah, I know it's hard. Some people, it's the last period thing, they would just want to watch one show and go to sleep. But really, it's not worth it. Consistency and routines, same bedtime, rituals, same bedtime, over and over. Think of it as a meeting, right? You have to do it every night, same time. Have a wind down period, right? And the wind down shouldn't be a glass of wine. Scotch is not a wind down. Working out is not a wind down. Wind down means getting your body ready for its slumber for 7 to 8 hours. Relaxing activities. Reading is wonderful. Yoga, shower, meditation, music, prayer, all of these things.
Because alcohol is actually actively disruptive.
Yes. Yeah. Alcohol is disruptful. Going for a jog before you go to sleep, disruptful. Anything that gets your sympathetic system up, not a good idea. So I'll go to supplements a little bit later, but supplements that really help with sleep that are clean, magnesium. Many of us are magnesium deficient. I put magnesium threonate there just because I think it's an easy starting point, but there are magnesium complexes that really help. It's good for cognition, it's good for sleep, it's good for cardiovascular health, and it's organic. So talk a little bit about supplementation. I wasn't a believer in this until I really did the deep dive and I realized we are, especially in healthcare, we're in building almost the entire time. And so taking supplements is pretty critical in longevity and mental health. So vitamin D3 or cholecalciferol, very critical on bone health, immune support, T cell activation, again, mood and mental health. It increases serotonin. There's different recommendations. I'm a big believer in 5,000 IUs on a daily basis with food in the morning. Big difference. Obviously, if you can get sunlight, great, but there will be a couple days where you don't get sunlight, right? Heart health reduces inflammation. We're going to talk a lot about inflammation. The biggest boogeyman in health now is inflammation. You find it, you name the disease that's related to inflammation. And then muscle function also helps. Cancer prevention, a lot of emerging data with colorectal and breast cancer prevention with high dose vitamin D. Magnesium, basically all of the above included in those benefits, but also improve nerve function and sleep, increases GABA function. Blood sugar regulation, migraine prevention, and digestion. So improved nerve function, again, goes to brain function, but also anyone that may have pains, aches, nerve conduction, tingling, magnesium is critical for that. Arrhythmias, one here. And then L-threonate, I find to be a very good one. It crosses the blood-brain barrier, it helps cognitive health, memory, brain function, and sleep. Okay. Glycinate's good for sleep and reducing anxiety, malady, energy support, chronic fatigue. Citrate treats constipation. There are magnesium complexes you can get. I'm happy offline. You guys want to contact me on recommendations. There are complexes that you can use, but depending on what you need and what you want. But magnesium is phenomenal. Fiber, digestion, increased satiety, improved glycemic control, right? For me, cravings are a big problem. I mean, eat late. And so at like 9 o'clock, 10 o'clock, suddenly, so we got to eat like 7,000 calories, right? And, yeah, let's get it real going. And so fiber is a key way to kind of control that blood sugar spike. And it's also very beneficial for colon health as well. Omega-3 fatty acids, some examples are EPA, DHA, and ALA. Heart, lowers triglycerides, prevents arrhythmias. Brain cognition, memory, reduces dementia, lowers depression, anxiety, mood state. You see them, like, there's a theme here with all these things. Everything affects mental health because mental health is connected to the rest. Immune support reduces autoimmune risk. Inflammation, autoimmune. B12, red blood cell production, improved nerve function, mood regulation, lower homocysteine. Homocysteine is a big player in coronary artery disease. And so happy to talk about that offline or another lecture on that. Lowering fatigue, higher vitality. Those are just some. Thorne tends to be a very good brand, organic brand that a lot of wellness folks work with. They're reputable companies. So I just put those up there. If anyone is interested, I can talk to you after the lecture as well. And so nutrition, I love this saying. Diet is when you watch what you eat and wish you could eat what you watch. Right? I watch people eat Doritos, and I'm telling you, ranch Doritos, my life, right? But if I eat a bag, then I'm going to be on the ground with arrhythmias for 2 days. So I wish it, but it's not going to happen. This I stole from Gary Brecka, who's a big well-being guy. If your grandmother couldn't recognize the ingredients, like malatofolate, hectarbate, it's not real. And so she's reading the ingredients on the food. I know organic is expensive, but it is truly worth it. If you can find somewhere to buy, especially the important things. It's worth the investment, and maybe you don't have to buy it as a portion, but it really is worth it. Meal prepping, I know it's difficult, but I come to work with my kind of meal already prepped, and it does help me quite a bit not to snack. Again, snacking is difficult, especially social environment. Someone brings cake, and then you go into Valentine's Day season, and then Christmas, and there's a lot of stuff. But just be mindful how this impacts you and how you feel. Just absolutely. This does not mean I don't like this stuff. Right? I love Pepsi. Right? I love Fanta, but these are absolute no-no. Soda is an absolute poison, right? But you know, again, life is short and all that stuff, but just be mindful. If you're drinking one soda a day, two sodas a day, you're doing some damage. And there's just processed foods, right? I know it's saying. So for me, like, how do I figure all this stuff out? I'm on a road with my son. I want to stop by 7-Eleven, grab one tea. How do I figure out what's healthy? The nuts healthy is healthy. And you have to scan it out. I give my wife credit for this. She's been trying to get me to do this for a year and worked. There are apps now. You just scan the label or take a picture of the food, and it will tell you what to eat. I was shocked because I thought I had organic peanut butter at home. Turns out it's not good for you. It causes inflammatory reaction. So it's free. You scan your food. It tells you that's not good, but you should buy this or and honestly, the price is about the same. Just know what to buy. And another one is the EWG Healthy Living app. And this one's actually pretty cool. Again, they're free. It'll give you kind of life tips on healthy being, food, and all that.
And back to Ryan for this one.
Just my last slide. So we're going to start talking about resilience and why it matters, especially as it relates to physical wellness. So the reality we all know is that healthcare workers, many of us are working long hours, there's shift work, there's a lot of high demands, musculoskeletal demands, emotional demands, physical demands, and so on and so forth. So what does that mean? That means stress. And lots of stress for everybody in this room. And what does that stress cause? That has been, we all know the term burnout. It's very, very common, especially in healthcare. High rates of burnout and depression and chronic fatigue. And one critical way of managing the stress is through developing resilience and grit. So what is resilience? Resilience, that means it is your ability to withstand, manage, and recover from stress. So that means to stay calm under pressure. That's your cognitive flexibility. That means to develop emotional strength, which means that you need to process difficult emotions. And I know every single one of us in this room has had to deal with processing difficult emotions, whether it's at home or at work. Physical stamina, we just talked about a lot of that with cardiovascular and strength training. And then positive coping mechanisms. And we're going to talk about that in the next few lectures, developing mindfulness and the benefits of mindfulness, and also peer support, reaching out to peers and other individuals that you can connect with. And then lastly, very, very important, purpose-driven motivation. This is where you find meaning in your work. This is why you show up. This is why you do what you do. You know, what is the reason? So resilience is absolutely critical, and that physical well-being is absolutely important in developing resilience. Introduce Chris.
So in the concept of how do we manage stress and how do we manage stress in the moment, right? Most of us are busy, we're working, something happens, and quickly we need to go to the next thing. So the next two slides, we're going to talk about things that you can do immediately in the moment, and they're breathing. It is the best way to manage your stress response. So there are two different techniques that we're going to talk about. This one, if you're familiar with the concept of boxed breathing, this is your 4x4 boxed breathing. This is really great for people like me that hold their breath. Like I'll just keep running and talking and keep going. And you're like, slow down and take a breath. It's very rhythmic and it's very purposeful. So you breathe in for 4 counts, you hold for 4 counts, you breathe out for 4 counts, you hold for 4 counts. And you just do that repetitively over and over and over. I remember when I sat for boards, I was so nervous because everybody knew I'd taken off work to do boards. And I sat in my car for like 20 minutes outside the testing center and it was just like, get yourself together and breathing box. So it's good too if you're a visual person. Did anybody watch Price is Right? I grew up with my grandparents, so like Price is Right was over at lunchtime. So the little guy that climbs up the mountain, that's what I always think of. The little guy is like climbing up the box and walking across the box. So this is a really great one to use in the moment. Whoops, did I mess it up? There we go. So okay. So it went off again. The other great technique to use is 4-7-8 breathing. So this is really great if you're somebody that tends to breathe really rapid and shallow. If you hyperventilate, 4-7-8 breathing. So the idea is that your out breath is twice as long as your in breath. You're going to blow off that carbon dioxide. You're going to slow that stress response down. So on this one, you're breathing in for 4 counts. You're holding for 7 counts, and then you're breathing out for 8 counts. So just again, that very rhythmic, very purposeful. You can make it as slow or as like speed up as you need if like 8 counts feels like a really long time. But you want your out breath to be twice as long as your in breath. That's what's going to stop that fight or flight stress response. Both of these two I'll mention are great to share with anybody. If nurses, share it with your patients. It's really, really great. Somebody's having a stress response, somebody's in a lot of pain. These are really great things that you can share with your patients as well.
All right. Thank you, Chris. So role of resilience, for the sake of time, I may not play the video, but I do want to mention why resilience is so important. I know we used a lot of it after COVID, but it is the ability to adapt and recover from different experiences. Personal, professional, we all have difficult situations. If you learn of how our brain wires through difficult times, it's really cool. And anterior mid-cingulate cortex is a really, really cool concept. I'll share this video in a future lecture series, but Andrew Huberman is brilliant. He's a Stanford neuroscientist. I follow him, just absolute brilliant work. That's with David Goggins, and they're talking about how doing things you hate doing difficult things, actually increases your longevity. And there's a portion of your brain that increases in size, hence you living a longer life, which I think is profound. And it's importance in overcoming challenges. Resilience is why immigrants and adversity-filled lives often lead to higher rates of prosperity, right? You show me someone that's super successful, they had an adverse childhood. And there's techniques to build resilience. We'll talk about this video at a future time. But again, it's all in our movies. It's all in our childhood. Rocky Balboa's story is all about grit and resilience. It's why we love the underdogs. It's why underdogs succeed. Rudy, true story, right? If your kids haven't seen this, if you haven't seen Rudy, watch it. It's really the fabric of this country, right? Whether you're an immigrant or your family was immigrants in the past, it's kind of how we start. But grit and resilience, you find a great leader, a great successful person, and it all comes back to grit and resilience. I will call out our hospitalist colleagues that are recovering 21, 22 patients, unprecedented, and me seeing what they were going through. After about a day or two of the shock, they were almost like smiling at the challenge. That's grit and resilience, right? And it was awesome to watch. And so it doesn't matter how many times you get knocked down, it's a matter of getting back up. And so what is up to you? None of this is going to come to you. It's like sleep. It's not going to suddenly come to you. You got to work on it. And another great video, what is grit and why does it matter? Angela Duckworth is another neuroscientist. She did a great TED talk they did a retrospective study on successful people around the world. And the number one predictive component of someone being, it had nothing to do with IQ, nothing to do with social quotient, nothing to do with charisma, sex, nothing. It all had to do with how much grit that person has. If you're willing to do something hard for a very, very, very long period of time and persist and be stubborn as a mule, that's grit, right? Healthcare, study, medical school beat you down, residency beat you down, private practice is going to beat you down, but you're going to keep doing it, right? And so that's grit. And there's a power to it. There's an optimism to it. And you have to recognize it because it's pretty cool. And it's the backbone of the growth mindset, the belief that one's abilities can be developed through effort and practice. If it's hard, do it. That's the whole point. And failure happens, and it's a good thing in this process, right? Grit and resilience is about having these troubling times. Our downtime, great example, right? We came out of it stronger. We came out of it with more resilience and grit. And, Churchill famously said, keep buggering on. Just keep doing it. Stop. And maybe that was the ethos that won the war at the end of the day. So, this is all on YouTube. Look up Angela Duckworth, really, really good stuff. Or go to my LinkedIn page. All this stuff is on there as well. And then our last piece is really how to build resilience. I'm going to hand it back to Chris here on some personal resilience building.
All right, and a lot of it is grit. So we're going to talk about one way to build grit is yoga. Who's ever taken a yoga class? Are you surprised how hard it is? Yeah, it's amazingly hard. So really quick, just for those who aren't familiar, what is yoga? Yoga is Sanskrit, it's yuju, and the idea is that you are joining or you are uniting. You are joining yourself with the universe and everything around you. We're going to talk a lot in the next couple slides about your environment and the interaction you have with your environment and how that affects you. So this is the joining of those two. But to be able to join with your environment, to be in a spot where you're aware of what's going on around you and the beauty of that, you got to be at a good spot inside. So that's the idea of what yoga is. How to practice yoga. So yoga is built on these 8 limbs of yoga. Most of us are familiar with the asanas. That's the postures or the poses. Sometimes the pranayamas, that's the breath control. So that's something that we talked about a couple slides back as well. And then we're going to talk about the dhyanas in a couple of slides. That's the meditation piece. Most yoga classes start and end with meditation. There's breathing through each posture, the enlightenment that comes in that moment between one posture to the next. They all work in unison with each other and they all build upon each other. So that sounds really great out there, right? How do we put that into what we understand? Maslow's hierarchy of need. You cannot have an enlightened higher self without having a solid foundation. So how do we practice? We practice on the mat. We practice in heat. We practice where it is uncomfortable. We practice in a pose where we feel like our muscle is going to fall off, right? You're shaking. It doesn't seem like you should be in so much pain, not real pain, holding a posture for so long, right? Why is that important? Because we are shutting off that monkey brain, right? We're shutting off that sympathetic response and we're coming into a parasympathetic response. It is very, very important for all of the reasons listed here. We talked about it earlier as well in cardiovascular health, all the benefits, the endocrine benefits, especially yoga is great for insulin uptake as well, glucose uptake. It helps to build a lot of lean muscle. It's also really great body strength training. So endocrine and metabolic functions improve, muscle and bone composition improve. Most importantly, cognitive and emotional, right? Big, big deal. Reduced feelings of anxiety and depression, decreased cortisol. Cortisol is a nasty little booger, right? Cortisol is going to increase anytime you have a stress response. And that's really important. We'll talk about it a little bit more later, but it really does wreak havoc on the body, just every system in the body. Increased levels of dopamine, serotonin, oxytocin, all those happy hormones. When you are done a yoga class, you walk out and you're like, ooh, right? You feel really, really good. We did talk about the brain neurotropic factor earlier. Again, it supports that brain health. It's cognitive function. It's all of those things in rapid fire happening really, really in sequence. Increased brainwave delta and alpha waves for improved cognitive and emotional responses and improved mental clarity and mindfulness. There was a study that was done on Buddhist monks. And they looked at Buddhist monks and their ability to improve their delta and alpha brainwaves. And they basically found that they had the ability, we'll talk about it a little bit later in another slide with meditation, but they had the ability that they could slow their brain down enough that they had a neural synchrony happening, which is really cool. Meditation. Anybody ever meditated? These are awesome. So meditation is the connection between the mind and the body and having control over the body by way of the mind. And So neurosynchrony, we just talked about, it is the ability to be able to have the brain fire alpha waves, delta waves in a synchronized manner so that your body, like we talked about that limbic system, your body is matching the response. So mind matches body physical response. Neuroplasticity is really cool. We have two forms of neuroplasticity. We have one that controls our memories. So repetitive actions, things that happen over and over again. Memories, emotions, that sort of stuff is built in that one branch of neuroplasticity. And that's really important when we think about things like PTSD. Right, when we have a situation that triggers a particular response, right? Or maybe it's a colleague or a situation. And when this happens, this always happens. And if we think about that in the negative, it creates that stress response so that before the end result ever happens, we've automatically already gone there. We've gone there in our mind and we've gone there in that physical, emotional response. So really, really important. To be able to get control of that, come back to that neurosynchrony and be able to say, okay, that situation caused this response, but I can change my automatic response. Start with breathing. The other neuroplasticity is really cool. Your body, your brain is able to take a damaged area of the brain and actually structurally move that piece to another area. Really important when we think about stroke patients. For example, you can actually be damaged in one area, and then the other part of the brain can take over and make up for that lost function. But if you are in a chronic state where you are just stressed and you are not able to relax, your brain's never going to be in a place where it can do that. So super important. How do we meditate? We sit there quietly, we stare at the wall. No, you can meditate any way you can. I actually did try that challenge once where you're supposed to sit and look at the wall and move up the wall. And then when your brain like drifted off to something, you had to go back down to like the floor. It's awful. Don't do that. It's so stressful. It completely negates the whole point. There are so many different ways that you can meditate. I personally love to run for miles. No headphones, no nothing, just listening to that rhythmic pattern. It's that rhythmic pattern that turns off. Again, you're turning off that fight or flight sympathetic response and you're coming into that parasympathetic rest and repair so that you can rest and repair. You can go through the emotional responses. You can go through the physical responses. How do I break down this issue? Whatever feels good to you. Purposeful movement is really good. Sitting quietly, you can. Being creative, just getting lost. My daughter loves to paint. We have paintings all over our house, canvases everywhere. And she'll just paint for hours. Our kitchen table will never be a beautiful table like it once was. It is covered in paint. It's her thing. Accomplishing a goal. Sometimes just like, I'm going to do this. Maybe it is 5,000 steps in a day, and you accomplish that. Connection. Connection is a really big piece we don't think a lot about in meditation. Really, really, really important. Dr. Adler was a big psychotherapist researcher, and he looked at the concept he did for community therapy was really his foundation. But the idea was that we find greater purpose in our life through connection. And without that, we can't ever come out of that stress response.
Let's just add that there's some really great apps out there too, kind of like the food stuff. So there's Insight Timer. Even this Burn Along has some really good stuff on it. So
Yeah, absolutely. And then how does the practice of meditation improve overall health and well-being? So we talked a lot about this in the previous slides. It's all the same thing, the same message. Improved neuroplasticity and synchrony, improved endocrine function, improved moods, improved relationships and interactions with other people. That's a really, really big one. This is where breath becomes really important when you move from one patient's room to the next patient's room, right? You've got to bring that energy back down. We take so much of our responses and the way we interact with each other from nonverbal cues. So it's a really big piece. Reduction in inflammation, reduction in cortisol. So cortisol directly relates to inflammation. Inflammation is going to cause every disease we talked about a little bit. It is a really big driver in cardiovascular disease. It is a big driver in poor endocrine function, reduction in stress and anxiety as well. And most importantly, why does this matter in healthcare? So we talked physical and mental health impacts your interactions with others. It impacts how you interact with your staff, with your colleagues, with patients, with family. It can take, I talk about this a lot. I have like a teenage daughter and a preteen daughter. There's a lot of that happens in your house. And there's a difference in good morning and good morning, right? And if you're in a spot where, you're just overwhelmed and you are not in that higher enlightened place, you're not going to give that out. And then the patient is going to feel like, oh, they don't really care about me, right? Your colleague is going to feel like, oh, what did I do to make her so upset? So it's very, very important. Improve physical and mental health. Again, that's so important. You saw the charts earlier relating to missed days at work burnout, enjoying what you do, finding purpose in what you do and why you're doing it, improved job retention and employee satisfaction. Those are two really big pieces. Practices can be taught to patients and family. Big piece. Everything that we talked about here, you're going to do for yourself, but it's going to become second nature. You're going to be like, yeah, I got this. And you're going to start giving it out to everyone that you come in contact with without even realizing it. It's just going to spill out of you. And then you get to heal your body too, which is a really good thing.
For the sake of time, thank you, everyone. I know we ran a little bit behind, but that's good. No tyranny of time here. We'll fly through these. I'm going to have Carlo talk about a quick slide. This will all be available on the Teams channel, and there's a couple things I would love for you guys to look up individually. Angela Duckworth, Andrew Huberman, YouTube these folks. Flow States, great mindfulness book. And then there's a Gaia app that's free, has a lot of very good wellness material at a pretty low price. So I'm going to hand it off to Carlo to mention something on one of his programs.
There we are. So really quick, if anybody is looking, not sure how to start getting moving, looking at some mindfulness and mental well-being, we have the resources. As it was mentioned, Burn Along is a great resource. If you're utilizing the platform already from your phone, you can scan those 2 QR codes and you can get some playlists that already exist for some of this material. And then you can start searching through other stuff. If you are, if you need the link to actually join Burn Along, maybe you haven't done that yet. It is actually on the handouts that I just sent you. It's not on the slide. I can get that, so please email me if you're online and need that link. And then lastly, if you're looking to tie everything together, if you need assistance with nutrition, exercise, anything like that, Diane is here. Please raise your hand, Diane. She is our health coach. She is here to help anybody who needs help. Please utilize her resource. It's free. It's for all employees. So thank you.
All right. Sorry, folks. We didn't have time for questions and all that. I know there's another group coming in, but appreciate it. Next lecture will be 4th Wednesday of next month. And same time, same channel. Thank you.